Hi friends, your holistic cardiologist here for some more information. Today I'm going to talk about magnesium. I talk about magnesium a lot with every single one of my patients, and I try to express to them how important it is to have magnesium as part of their heart healthy diet, whether it's because if they've got a high blood pressure, blood sugar issues, or whether it's fatigue, exhaustion, tiredness, but we'll get into that in a second. But I thought I'd do this little video to explain the whole concept of magnesium and why it's so important. All right, so here it goes. Hope you enjoy this. So magnesium, it's critical to your nervous system. It's critical to your bones, your heart health. It's important for your bowels, gut health, stress and relaxation. It really makes a big difference when you're using that, as well as, typically your body has 25 grams of magnesium. And so you need to replete that. And the problem most of the time that I'm finding is that we're not repleting our magnesium because even though we're trying to get it through our diets are very poor. And the quality of our foods are getting very poor. So therefore, we're not being able to absorb it very well. Plus, as we age, we're losing magnesium anyway, right? Through our muscles, bones, and so on. So it's very important for us to be able to develop our magnesium and keep our levels decently high. It's a cofactor of more than 300 enzyme biochemical reactions in the body. So magnesium is one of the most important salts that we have, the elements. It's actually element number 12. And so apart from sodium, potassium, chloride, but magnesium is one of the higher ones on the list as a mineral. Some of the sources: leafy vegetables, pumpkin seeds, chia seeds, what else? Fish, dairy, vegetables. They're very important sources of magnesium. Most people remain magnesium deficient and they don't even realize it. They've got all sorts of symptoms. So what are some of the symptoms of magnesium deficiency? Tiredness, mood disorder, hypertension, cardiovascular disease, sleep mood disorders, gut issues, weakness, fatigue, and actually even headaches. Now, when you start looking at magnesium, the first thing patients ask me, well, which magnesium should I take? There are so many on the market. They're absolutely right. There are 10 different kinds of magnesiums, and I want to go through each one so you have a clear understanding of what they are and what they're used for. And I'll start off with the top 3 that are my favorite and more importantly, what I think that you should use them for. Okay? Magnesium glycinate. It's very well absorbed. It's good for heart health, sleep, anxiety, stress. It helps with the gut health. It's in a lot of protein-rich foods. So that's my number 1 favorite. So when people ask me, I usually tell them, take that one. The next one is the magnesium citrate, found usually in citrus fruits. It's actually commonly used as more of a laxative than anything else. Magnesium oxide, that's basically magnesium and oxygen they put together. It's not really used for deficiencies, but it's used more for things like heartburn and constipation. Magnesium chloride, more used as skin creams and sore muscles. It's in many of these gels that people use for aches and pains. Magnesium lactate, this one helps with digestion. Magnesium malate, it's basically magnesium and malic acid put together. It's found in fruit and wines. It's good for fatigue. It was also studied a lot in fibromyalgia. Magnesium and taurine, that's basically magnesium taurate, that helps for blood sugar and blood pressure as well, as does the magnesium glycinate we talked about earlier. Magnesium threonate, it's a salt from magnesium and threonic acid, which is a derivative from vitamin C, helps with Alzheimer's, memory loss, depression. The other one is magnesium sulfate. Epsom salts is found usually if it's a tablet form, it's a capsule, it's for constipation. Otherwise, if it's in just salt form, it's used in bath water, and so you can just relax and soak in it. It helps with all muscle aches and pains. Then there's magnesium orotate, magnesium and orotic acid, easily absorbed and promotes heart health. Now, those are your 10. The top 3 we talked about was your magnesium citrate, magnesium oxide, and your magnesium glycinate. And I always prefer, people say, like, how much I should take? I should take a supplement. Well, if you need to take it as a supplement, go ahead, right? Females, 320 milligrams a day. Men, about 420 milligrams a day. But I prefer it in natural foods, like legumes, beans, edamame, vegetables, like spinach, kale, avocado, nuts, almonds, cashews, oatmeal, pumpkin seeds, chia seeds, fish. So take a look and see what you're able to handle. Now, of course, there are interactions sometimes with magnesium and other medications that you might be taking, so always just check with your healthcare provider if there won't be any interaction in that regard. If you start feeling sickly when you're taking the magnesium, use your common sense regarding whether continuing to take it, maybe stopping it, seeing whether your symptoms have improved, or retaking it again, and then seeing whether the symptoms come back is also very important, just to gauge in terms of whether it's the magnesium that's causing it. Magnesium toxicity is pretty rare, and you really need to have a massive amount of magnesium before you can get to toxicity. But sometimes other medications potentiate the effect of the magnesium, so you've got to be careful. All right? So hope that helps. As a little summary for magnesium, I talk about this literally to every single patient, and I've been doing that for decades. And I finally said, you know what? I'm just going to make a little educational video on magnesium, and hope it helps you. Blessings.